Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. Before we get into our COVID update, could we talk a little bit about the flooding that's happening in our country? Just a general update. And specifically, I have NCN is asking if our COVID campaign has been affected in any sort of way. We had addressed that before. And Luke Caribbean, they're also asking with in terms of drugs if the health centers are having what they need, especially with the possibility of waterborne diseases and so on.
Well, that's quite a lot of questions in one go. Um, but we have health teams in all the regions, and as you know, and as I've reported before, the regional health officers and their staff within the regions have been monitoring the situation in those regions. In Region 1, they have been constantly monitoring. From the reports that I've had this morning, they haven't had any outbreaks of anything. Same goes for Region 7, 8, and 9. There are a few isolated cases of skin rashes and so that people have been reporting, but those have been dealt with. In Regions 2, we have an outreach team that is going into the Pomeroon today just to go back and do some checks to see if there's any, anything that they need to look at. But the team has been there before. It's going back in again today. And in addition to monitoring for waterborne diseases, they would also be doing vaccination in the Pomeroon. In Region 7, we have teams that have gone into the upper and middle Maz, and they're monitoring for both waterborne diseases caused by flooding, and they're also going to be doing vaccination in those communities that they visit. We also have teams that are out in Region 8, and the team in 8 would have assisted with the CDC to move some of the residents in the area of Chumatumari to the primary school there. They have set up a shelter. I think there are about 5 families that have been affected, and those families right now are with other relatives, so they're not staying at the school, but we have the school prepared just in case if anybody want to come there. In Region 5, we continue to monitor the Mahaika and Maikoni creeks. And yesterday we had teams that went to both communities, and teams are going to go out back there again today just to continue the monitoring and to ensure that whatever reports we get of waterborne illnesses that they can, first of all, to check, see whether there are any reports of waterborne illnesses, and then to deal with them. And similarly in Region 6, those types of monitoring exercises continue. In terms of whether we have adequate medication to deal with this, as you would have heard, we have been doing a couple of things through the regional system. We have skin ointments or ointments for rashes and so forth. We have been distributing that to various communities. We have also been giving out bleach so that people can use that to purify their water supply. And we have been on the lookout for diarrheal diseases, and we have distributed ORS, oral rehydration salts, widely. So this is an ongoing exercise, and we continue to monitor to make sure that all the health centers, health posts, they have adequate supplies of medicines.
Okay, thank you, sir. Could we have our updates on figures, vaccination figures, as of?
So as of yesterday, we've had 212,541 persons receiving their first dose vaccines. That would be approximately 43.7% of our adult population. And as of yesterday, we have had 77,980 persons who would have been fully immunized. That represents about 15.6% of our adult population. So we continue to work on this, and we're asking those persons who would have received their AstraZeneca vaccine earlier that they can come now and get their second dose. You can receive that second dose anytime between 4 weeks and 12 weeks. I know that earlier we had put on the card for people to come back after 12 weeks. But the guidance is anytime between 4 weeks to 12 weeks that you can come for that second dose once you have received an AstraZeneca vaccine as the first dose. Similarly, we still have a few persons who would have received the Sinopharm vaccine, but they haven't come forward to get their second dose Sinopharm vaccine. They got their first dose, but they haven't come back for their second dose. So we want to appeal to those persons to come and to get that second dose, because without the second dose, you would not be fully immunized. And then, of course, we have the Sputnik V. So we have received a substantial supply of Sputnik V, and we are going to roll out that to make sure that more people can get their first dose vaccination.
All right. I wanted to ask you, I know we've spoken about Region 10 and some of the Amerindian communities that are still a bit hesitant. Has any change? Have we had any sort of change in those communities?
Region 10, we still have a lot of people not coming out to get the vaccine. They have the lowest vaccination rates to date. There have been marginal improvement from when we start talking about this. As of today, the first dose vaccination in Region 10 is approximately 12.9% of the population. And when you compare that with, say, Region 6, which has first doses 51.5%, you can see by how much they are lagging. So again, we want to encourage people to come and take the vaccine because it's safe. And we have a number of fixed sites that are constantly open. So anyone who really want to get a vaccine can come to any of those sites and they'll be given the vaccine.
Okay, sir. We have a question from Newsroom. They're asking how many doses of the Sinopharm we're getting from China this month, and if you have an idea of the cost. And they're also asking for an update on the second dose for the Sputnik V.
So we have purchased from Sinopharm 100,000 doses of the Sinopharm vaccine. That approximates to about $15 per dose. And we have to add another maybe $2 to $3 for the transportation of the vaccine. So $2 to $3 per dose. You normally factor that in as transportation for the vaccine. So that would be the cost of what we are paying for those vaccines. In terms of the Sputnik V second dose, we continue to work with the supplier to see how fast we can get those second dose in. We have already paid for these second doses. It's just a matter of getting the supply into Guyana. Hopefully, we'll either get that by the end of this week or maybe early next week. But again, I just want to remind people that for second dose Sputnik, again, it's between 4 weeks to 12 weeks. So for those persons who would have received their vaccines, you still have some time to get your second dose. And the longer you delay in getting that second dose, the more robust or longer the immunity would last. So that's just something for people to also understand.
Okay, no need for people to be that concerned. All right, thank you so much for clearing that up. I have one question from Nightly News, and they're asking on June 4th, the ministry reported two deaths from May 26 and May 27. There seems to be a delay in reporting the fatalities in May, and they're asking, can you explain why these deaths were not reported sooner?
The explanation is quite a simple one because we do have persons who would pass away, let's say in one of the regions. When those deaths are made known to us, if the person would have displayed symptoms or signs of COVID, then a swab is taken and that swab has to be processed. So it takes some time before we can definitively say that this person was infected with the SARS-CoV-2 virus. So that's the reason why. So while the person might pass away on a particular date, the confirmation of what they died from might be delayed until we have a PCR test done. And that's the reason. So when we know that for sure, then the death is actually reported as a COVID-19 death.
Okay, Minister, thank you so much. Well, thank you again for speaking with us.
Okay.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and of course, the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.